Good afternoon once again. Today is Tuesday, the 5th of January, 2021. And this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration, or CCSA, as always. Today is Tuesday. We had a cabinet meeting in the morning. I believe it's not done yet, so we'll wait for the results of that meeting. The spokesperson ended just now with some food for thought, which is very important. The overarching question is, where are we in COVID? Where do we want to be during COVID? Will we be in the fear zone, in the learning zone, or in the growth zone? For Thailand, of course, we believe that we've been in the growth zone since the beginning of this year. This new wave has been a very daunting challenge for us. It's been 3 weeks already for this new wave. It has caused a lot of high numbers, high new infections, but we believe that we can jump right into the growth zone. Of course, the fear zone for COVID, if you want to be in the fear zone in COVID, that would mean us sending information on social media right away without checking. That would be us being too worrisome, not acting to solve or contain the virus, being lax in our measures. That means we're in the fear zone. If we're in the learning zone, of course, we're open to new information. We're open to the initiatives. We have an open heart to all the measures that are announced, and then we try to help each other and learn how best to deal with this situation, which is, of course, dynamic. But the growth zone, as the spokesperson had mentioned, is the most important. In the growth zone, we have empathy for each other. We appreciate each other, we listen to each other, we live in the present, and we work to fight for the future, for a healthier future. So that's the growth zone where we should all be. This food for thought is courtesy of Dr. Sawit Mesinsi. And it is very important for us to have a positive outlook and the positive energy in this growth zone mentality of ours. I'll move on to the general situation and number of cases that we have for today, and we'll have a template slide coming up for you soon. Yes, the new confirmed cases for today, we have recorded 527 cases, making the cumulative number of cases in Thailand now standing at 8,966. Out of the 527 cases recorded for today, 439 cases are results of the active case finding, and 6 cases from those already in state quarantine, 82 cases from local transmission. New recoveries, we have recorded 45 new recoveries for today, making the cumulative number of recoveries, or those discharged from medical facilities, standing at 4,397. With no new fatalities, the total of fatalities remaining at 6. Surprised by the spokesperson. I'll recap some of that here. First of all, we have 56 provinces now affected by this new wave. Yesterday, it was still 54. Today, the 2 new provinces include Singburi and Nan province, who have recorded new cases for today for the first time, making it now 56 provinces out of the total number of provinces in the country. One case in point is, if we average out some of the statistics and numbers that we have, if we do the analytics for each particular province, it would be very useful. So we have that for you for Rayong province, just as one example, an analytic type of information for Rayong province. In the past months, there have been infections in Rayong in terms of female more than males, women more than men. The average age being 49 years old, and most of those infected were asymptomatic. That's 57% of all those infected in the Rayong cluster being asymptomatic, having no symptoms. The venue that is most probable for the source of the infection in Rayong province, as a specific case, is the gambling dens, illegal gambling dens, the gray areas they played a large role in spreading the infection for those who did not, to those who did not go to gambling dens. And of course, for certain cases, certain patients, we have also the timeline for each particular patient, which we look into detail after we have completed the timeline. For example, infected person number 50 for today's case, recorded out of the 527, 50 from Chiang Mai province. We have that timeline, and that serves as crucial information for our future analysis. The trend, however, in the general picture in Thailand is that there continues to be an increase in the spreading of infection in the same areas, in the same localities that we have already identified. And the places that have been the cluster for these infections remain the gray areas, such as local gambling in the provinces, local gambling areas, and cockfighting venues as well. So on measures, I'll just recap on some of the important measures that you have probably seen in the news yesterday as well. The General CCSA meeting chaired by the Prime Minister yesterday, attended by relevant authorities yesterday afternoon, emphasized that there had not been any lockdown per se, lockdown orders given so far, but rather more stringent and strict measures put in place on top of those that were already approved by the central government to ensure effective containment of COVID. So each province have issued stronger measures on top of the general measures by the government, and many measures and recommendations were discussed in the CCSA. Just a case in point is the number of eastern provinces in Thailand, around 4 eastern provinces, and if you put it in the general picture, perhaps around 5 eastern provinces, such as Samut Sakhon, Rayong, Chonburi, Chantaburi, and Trat provinces. These 5 provinces have been in particular focus, not in terms of announcing a lockdown, but in terms of the more stringent measures on top of the measures already announced. So if you see the map in the media or in the Thai presentation, the level 1 is colored in red. We're contemplating on designating these 4 or 5 provinces as being on a higher category than the red one. Perhaps we'll color it as maroon color, because these 5 provinces are very much at risk, and more stringent measures have been put in place. Another example is about in Bangkok Metropolitan Authority, the issue about dine-in options in restaurants. So as we mentioned quite often, we have to seek a balanced approach in order to flatten the COVID curve. And it's important in Bangkok because, of course, the capital city has a congested population, and there are many businesses going on, of course. So as per the directive of the CCSA, the Communicable Disease Committee of Bangkok Metropolitan Authority have decided to permit restaurants and eateries in the Bangkok area to provide dine-in services for customers until 9 p.m. So that's basically from 6 a.m. to 9 p.m. Dine-in options. The dine-in option is still permitted starting on the 5th of January today. And from 9 p.m. onwards until 6 a.m. the following day, it has to be takeaway service that would remain the only option provided to customers. The spokesperson mentioned that the restaurant industry and the Thai Restaurants Association of Thailand have been providing good cooperation with the CCSA in terms of informing their members about the strict measures on how restaurants should conduct themselves, and of course not open dine-in services after 9 p.m. They must strictly adhere to the public health measures, including no consumption of alcohol, providing partition, the plastic partitions in restaurants, with at least 1.5 meters of physical distancing. The partition will be coming back, basically. The provision of alcohol gel, of course, rubbing alcohol, and the daily cleaning up, taking out of garbage, no garbage to remain in premises, amongst other health-related measures. The Health Ministry, in cooperation with authorities, will closely monitor and enforce these measures with possible punitive action for restaurants. And these establishments that fail to follow the established protocol will be dealt with according to the measures. One important cluster of information is about the vaccine procurement, which we talked about yesterday as well. The Thai government, through the Health Ministry, in collaboration with the Foreign Ministry, have been opening up doors to discuss with various entities, be it them foreign governments, foreign companies, or vaccine institutes around the world, to procure close to 28 million doses with a view to containing the spread in Thailand through timely inoculation. We are currently in talks with various pharmaceutical companies and interlocutors to increase the amount of vaccines to be made available to the public, with a goal of inoculating no less than 50% of the population. In terms of numbers, talking about vaccinating more than 33 million people with about 70 million doses. So the Foreign Ministry and the Thai embassies abroad have been facilitating these talks along with the Health Ministry, the National Vaccine Institute of Thailand, and relevant agencies and pharmaceutical companies to secure doses, for example, such as the 26 million doses from AstraZeneca. Additionally, 2 million doses from Sinovac, of course, pending FDA approval in their countries and in Thailand as well. But this information, of course, sometimes we give you advanced information on the process, but by the time it gets here, of course, FDA approval. If that, I saw that inquiry one or two inquiries on the FDA standard approval on social media. So of course, by the time it arrives, that would be of minimum standard. The government has also supported the World Health Organization's COVAX facility under the ACT Accelerator Program in research, development, and procurement of vaccines as public goods for equitable access by all countries. And furthermore, Thailand has also started local production of vaccines developed by AstraZeneca under technology transfer agreement, and it is expected to be ready for distribution this year. Of course, the timeline that we have, it's kind of a varied timeline for some advanced purchase agreement, and of course for certain brands or certain procurements, it will come in different months. And as soon as, of course, we have the finalization of that, we'll be talking about that. But rest assured, of course, within the early parts of this year, all of these initiatives will bear fruit. We're not closing up any opportunities for discussion with private companies and other countries around the world for additional options aside from those already mentioned. Now moving on to the Mochana application, the Digital Economy Ministry of Digital Economy and Society reaffirmed yesterday that the Mochana application, as you see on screen here with a QR code, this application, a contact tracing application, can now support up to 20 million users. And within 2 weeks' time, the application will be able to support 40 million users around the country. You can also make use of this application by downloading it from Play Store on Android and App Store on iOS. And you have a QR code there. And confirmed it is available in the English language as well, the application. Please check that out. The CCSA therefore encourages the use of both the Thai Chana application and the Mo Chana application. These applications for your daily lives, be it going to your offices or visiting restaurants and cafes during this new normal era to help contain COVID and save lives of those nearest and dearest to you. Now about masks, the spokesperson mentioned a little bit about masks. We urge the public to wear masks all the time, of course, when in public to prevent yourselves and others from contracting infection. You're encouraged to use masks, and of course, cloth masks and non-surgical masks are usable. Surgical masks are meant for healthcare workers. Of course, that they should be reserved for healthcare workers first and other medical first responders. One announcement on the closure of certain venues, which are traditionally tourist venues in Thailand, including royal palaces. So please be informed that as of yesterday, the Bureau of the Royal Household announced the closure of royal palaces and locations from now until the end of January. The list includes the Grand Palace and the Emerald Buddha Temple, the Queen Sirikit Museum of Textile, Bang Pa-in Palace, Arts of the Kingdom, Phuping Palace, Sala Chalerm Krung Royal Theatre, and Chang Huo Man Project, which is a royal initiative. We have received some inquiries on social media, and as I mentioned, we'll try to address that on air or through our inboxes. Some inquiries about self-quarantine when you travel to level 1 areas. Also, those, if you arrive from Bangkok from abroad, of course, you're immediately placed into the alternative state quarantine. But if you travel from other provinces to Bangkok or Bangkok to other provinces, and these provinces are actually level 1, the advice is, of course, firstly, to follow the announcements of each province. But it is also advisable for you to undergo 14 days self-quarantine. 14 days self-quarantine. And reminder that Bangkok, of course, is level 1 as well. So when you arrive at your destination, advising you to undergo self-quarantine. Look at the information of each particular province. We talked about the sources of that you can find in English language information. We talked about that yesterday as well. The spokesperson highlighted that you have to take note of the different measures in place of the specific localities and follow them accordingly. He also summarized an order, a Ministry of Interior order, which was a result of a discussion in the CCSA general meeting yesterday. Now, that order basically outlines that the DMHTT principle, distancing, of course, you can regurgitate and you can probably cite what DMHTT stands for by now, hopefully. So firstly is for that DMHTT is for all. It's a must for all, for everybody. Secondly, as I mentioned just now about self-quarantine, when you travel from level 1 provinces or provinces which we call highly controlled areas, self-quarantine is very much advisable, strongly advised. The third is that in the MOI order, it talks about the closure of more venues that are risk venues. And we're going to get very serious and stringent on that. The fourth is about the dine-in restaurants, as I summarized just now, for in Bangkok in particular, closing at 9 p.m. and not after 9 p.m. Until 6 a.m., during which time only takeaway or delivery is permitted. And the fifth is about the stronger measures will be put in place for inter-provincial travel in terms of the checkpoints. And the summary is that we advise for inter-provincial travel to be done only if necessary. Some have been asking about what is the rationale or reasoning for what is reasonable in terms of inter-provincial travel. Of course, for medical purposes, for family purposes, for important activities, and how can that be proven? So for medical visits, of course, you have the medical appointment documents and everything, and for the other important activities that you must do in inter-province, I think there's a common line of of reasonableness that the authorities will be able to understand. If, for example, you have parents or family who are sick, of course, there are documents that you can prove on that. You can have pictures, of course, and all the important businesses. It can be explained to the authorities when entering and traveling inter-province. That is, of course, in the case that you're asked on why you're traveling inter-province. So in summary, this is the information that I wanted to summarize, recap for you today. Please don't forget to check yourself in to both Thai Chana and Mo Chana applications, which are available in English. Please wear the mask all the time in public places. And remember that your personal responsibility in following public health guidelines have implications, have ramifications on the collective well-being of society. And we all need to look out for one another during these trying times. Just to recap in the beginning, I mentioned about the fear zone, the learning zone, and the growth zone. We should not remain in the fear zone if any of you have thought that you have been in the fear zone. That's how to deal with crisis. That's how to fight off our common enemy. Some of us can be in the learning zone, and learn as we go along. It's all a learning process for all of us. It's a test for all of us, for the learning zone, learning what's the new, how COVID affects us, what new measures we can do to help fend off COVID. But the most important is to remain and stay strong in the growth zone and have empathy, have understanding, and help one another in this zone as we fight off COVID together. So the battle still continues, and we're all in the same boat. Please stay safe and stay healthy, and I'll see you again tomorrow. Thank you very much. สวัสดีครับ
ครับขอบพระคุณนะครับท่านณัฐภานุนพคุณนะครับรองอธิบดี